Sarah Godinez, and I have been a registered nurse for almost 3 years. I started my nursing career in the emergency department. After a year, I transferred to the GI clinic where we do colonoscopies and EGDs every day. Today, we're going to be discussing Parkinson's disease. Objectives of this presentation include understanding the pathophysiology of Parkinson's disease, discussing clinical manifestations, diagnostic procedures, and treatments for this disease, as well as evaluating important information for patients. What is Parkinson's disease? Parkinson's disease is a common and progressive disease resulting in a loss of neuron in the substantia nigra and reduction of the neurotransmitter dopamine in the brain. Every year, 50,000 Americans are diagnosed with Parkinson's disease. The etiology of Parkinson's disease is not known. However, there are many factors that are theorized to be associated with the development, such as genetic vulnerability, which includes family history of Parkinson's disease, the occurrence of sporadic alterations in the genes, as well as activation of the disease due to environmental triggers such as viruses. The pathophysiology of Parkinson's disease includes many factors such as genes that are linked to the family history, and these genes include PARC1 through PARC13. They are in charge of proteins such as the alpha-synuclein, which takes part in the release of neurotransmitters, as well as the leucine-rich repeat kinase 2, which provides information for the formation of DARDARN proteins. Another component is the cellular level abnormalities. These occur due to Parkinson's disease and include oxidative stress, mitochondrial dysfunction, excitotoxicity, immune regulation and inflammation leading to neural depigmentation, neuronal loss, and glial cell abnormalities that transpire in multiple areas of the basal ganglia, most commonly the substantia nigra. Parkinson's disease is a dopamine depletion. With that being said, dopamine is also needed for the norepinephrine producing cells. Without dopamine, these cells may be destroyed, which can be an explanation for the blood pressure regulation issues that occur with Parkinson's disease. Non-motor presentations begin to manifest before clinical signs and diagnosis of Parkinson's disease. So some non-motor manifestations of Parkinson's disease include sleep-wake cycle regulation disorders, such as individuals who experience hypersomnia during the day and insomnia during the night, cognitive impairments such as impaired decision-making, mood and affect disorders, which include anxiety and depression, dementia, hallucinations, which are typically visual and may be accompanied by psychosis and delusions, sensory symptoms and pain that is described as tingling, burning, localized or generalized, autonomic dysfunction, which includes the decrease in body weight, orthostatic hypotension, nocturia, decreased libido, high sensitivity to temperatures, as well as abnormal body temperatures. Some motor manifestations include tremors, which occur during periods of rest and subside during intentional movement. Over time, tremors may move to lips, jaw, and tongue as they worsen. Other manifestations include rigidity, bradykinesia, which is the generalized slowness of movement, postural instability leading to an increased risk for falls, as well as gait disorders such as short shuffling steps. Diagnosis for Parkinson's disease. The most definitive way to diagnose this disease is based on neuropathology findings on an autopsy. However, clinical diagnosis for Parkinson's disease includes the presentation of 3 cardinal symptoms, which are tremors, bradykinesia, and rigidity. Diagnostic tests include PET scans, which detect advanced Parkinson's disease due to increased numbers of dopaminergic neuron loss in the substantia nigra. And genetic testing can provide insight to individuals to evaluate their risk for Parkinson's disease. Risk factors for Parkinson's disease include modifiable risk factors such as your occupation, long exposure to pesticides, and studies have shown that depression, repeated head injuries, and hypertension have all been associated with the development of Parkinson's disease. It is stated in studies that individuals who reside in Europe, North America, and South America have a higher incidence of developing Parkinson's disease. Some non-modifiable risk factors include the increase of age and being of the male gender. As Parkinson's disease is generally diagnosed around age 60, and men are twice as likely to be affected with Parkinson's disease. Having a family history significantly increases an individual's likelihood for developing this disease. Some treatment options for Parkinson's disease include marijuana, as it has been studied and proven to reduce motor and non-motor signs and symptoms of Parkinson's disease. Physical therapy has been shown to improve mobility, gait, balance, strength, dexterity, and endurance, and decrease the risk in falls. Oral nicotine has been known to decrease dyskinesia effects that are brought on by levodopa. Some pharmacological treatments for this disease include levodopa, which is used as it increases the levels of dopamine in the brain, leading to a decrease in rigidity and tremors. Dopamine agonists, such as ropinirole, is used to activate dopamine receptors in the brain, decreasing rigidity and tremors, having a longer half-life than levodopa. Monoamine oxidase type B is a class of drugs that is used to treat Parkinson's disease, as it prevents the breakdown of dopamine, leading to an increase in availability of dopamine and decreased motor symptoms. So some important topics to discuss with your patient is educating them on the importance of administering medication exactly when it is due, as it is crucial for treatment. Patients should be instructed to increase their daily intake of fluids up to 3 liters a day, as well as increasing whole grains to create bulk in their stool in order to prevent constipation. Education about proper sleep habits and modifications to increase quality of sleep, including the limitation of noise, lights, and interruptions, should be implemented to facilitate adequate sleep and rest cycles. Patients and families may be provided with information on support groups, either online or in person, to help cope and manage with the changes in lifestyle, as well as help prevent caregiver burden. The MSN Essential Domain 2 has been incorporated in this presentation through the explanation of genetic factors, pharmacological treatment options, the evaluation of environmental risk factors, and through the process of essential education for patients and families. And here are my list of references for this presentation. Thank you.